Hello, everyone. Good morning, good afternoon. Welcome to this week's edition of It's Worth a Shot, hosted by Mountain Pacific Quality Health. And this week, we will be discussing the value in audits and taking a closer look at that audit process and the importance of conducting audits, as well as highlighting the Hawaii Infection Prevention Network. Today is May 24th, 2023. Thank you, everybody, for joining us as always. And I hope that you enjoy some information that we have for you today. Looks like we have a few folks joining us from the waiting room. All right, next slide, please. So as always, our few housekeeping items. Feel free to add your webinar topics and clinician ideas into chat. We'll continue to meet every Wednesday. And a friendly reminder that we do have that evaluation link that we routinely put into the chat box. We would love to hear from you. And when you take that evaluation, there is an opportunity to enter comments at the end of the eval if you have any topic ideas. So again, we'd love to hear from you guys. We do have one quick polling question to kick us off for this week's edition. Does your consultant pharmacist help provide medication or immunization education in your community? We'll give folks just a few moments to answer that. And as always, thank you for taking the time to complete these polling questions. They help us to align resources. All right, so give you a few more moments here before we close out that polling question. Again, does your consultant pharmacist help provide medication or immunization education in your community? I did not mean for that to rhyme, by the way. All right, it looks like majority of folks responded no. Thanks as always. We'll go ahead and close that out. All right, next slide, please. So a few updates and reminders for this week. I just wanted to take a few moments and point out when we sent our quarterly quality measure reports out over this last few weeks, you may have noticed that we have added vaccination rates to your quarterly reports. Those included the pneumococcal, influenza, and COVID-19, specifically up-to-date vaccination status data for your facility. And I just wanted to point out that when you look at that infographic that is now incorporated into those reports, you'll notice that the blue is your facility. So you can track and trend and take that to QAPI if need be. The red line on those graphs is your state average. And then the green line is the national average. So again, when you take a peek at those quarterly reports, you'll notice that pneumococcal influenza and COVID-19 vaccination data was added to there. And you can take a look and see how you compare against your state and national partners. And again, if there's opportunity to take that to QAPI, you have that data in front of you. Also, just a quick update. vSafe, some of us may be familiar with this this program. This program was initiated to help track vaccine safety and symptom monitoring, and it will be sunsetting. It actually closed for enrollment on the 19th. You can still access the vSafe program if you're currently enrolled, but it did sunset on the 19th. I'm sharing this forward because, again, a lot of folks enrolled in this. It was helped It was developed specifically for COVID-19 vaccines and has really been an essential component of monitoring vaccine safety. What is happening after the 19th is the CDC is actually developing a new program. So stay tuned as we look to hear launch of that program. And it sounds like we should hear sometime in June what that new platform is going to look like. And it'll just be pretty similar to VSafe, where you can still monitor for vaccine safety and track that data. Again, that program was pretty cool. It was launched in December of 2020, and 151 million health surveys were completed through it. So stay tuned for more. Next slide, please. And a few other reminders. So the, switch in my slide here. So the weekly review, again, that has officially signed off, that COVID data tracker weekly review platform. That is officially sunsetted as of May 11th. So we have really transitioned to look at COVID-19 data more towards the COVID-19 hospitalizations, deaths, and emergency visit statistics. So those statistics, that data will specifically serve as an early indicator of COVID-19 activity now in your community. And that county level electronic lab reporting data on test positivity will be no longer posted at the national level. And the COVID data tracker, it's going to look a little bit different moving forward. And I know we've been pulling this up. So as we look at this last reporting period ending May 18th, you can see a reflection on the hospital admission data, percent change in COVID-19 hospital admissions, which is actually down, which is great news. And then hospital admissions, COVID-19 hospital admissions, just at 2.77%. So good news all around as we see those lower numbers. And next slide, please. Quick peek at the COVID-19 hospital admission levels. Again, these COVID-19 hospital admission levels replace the COVID-19 community levels and will act as the main indicator of county trends. And these hospital admission levels, those would be comparable to those community levels. So lots of green, which is wonderful news and what we want to see for sure. All right, next slide, please. So last week we did have a question pop into chat, and I was also emailed after the presentation, so I wanted to bring this back up. The question was, if an individual receives a bivalent COVID-19 vaccine, but did not receive the primary, are they considered up to date? Yes, under the new recommendations and guidance, if you have received a bivalent vaccine, you are now considered up to date. All right, with that, next slide, please. So today we will start off this week's presentation discussing audits, the why, what, when, how. Shay, the floor is yours.
Thanks, Jessie. Hi, everyone. And again, thank you for joining us today on this week's It's Worth a Shot. My name is Shay Trapton, and I'm an account manager here at Mountain Pacific and currently based out of Montana. So today I just wanted to briefly touch on audits, mainly the whys, whens, whats, and hows of auditing. Next slide, please. So there's a reason surveyors come into the facility and ask for audits. Audits support and provide the proof of your efforts and work. The auditing process provides your basis and guides quality improvement. And when conducting audits appropriately, they should be able to show trends that lead to the root cause of potential breakdowns, areas of improvement. And then at times facilities are auditing, but you guys just aren't documenting or taking credit for your processes and your work. So we just want to make sure that you guys are doing that. And then lastly, audits are capable of identifying areas that need improvement and the areas the facility is actually excelling at. So there are good and I guess bads to serve or to auditing. So next slide, please. So obviously the when to audit. So we like to look at auditing, and realistically audits are occurring and should be conducted continuously, because as professionals and caregivers, we are constantly trying to better ourselves and the lives of those that we take care of. So therefore, auditing should be part of your daily activities. When incidents occur in the facility, isolated or not, auditing the process and procedure will help drive the quality improvement process. Next slide, please. All right, so we look at what to audit. So again, there's multiple avenues to go down here, but I'll keep them at a high level. So first we look at, I guess actually when I look at this, I should have made a list of what not to audit. That would have been a little bit shorter for you guys today, but I'm going to just hit on a few main points here. So infection control transmission occurs usually in three main avenues. So you look at your dirty hands, your dirty equipment, and or a dirty environment. So from the IP perspective, the main areas that must be audited would be along these lines. So specifically donning and doffing. And then if you are using hand sanitizer going in and out of residence rooms or in other, contacts with your residents. So when resident cares are being done, we like to make sure that they are done in a timely and appropriate manner. So this is where an audit could come in handy. A lot of times, you have your CNA supervisor, if you have one, or a supervisor, making sure that residents are being taken care of appropriately. And along those lines, charting would help encompass, your aspects such as your ADLs, your medications, and your residents' preferences. So in regards to those medications, auditing the logs to ensure that all medications are being given appropriately, as well as ensuring the medication is treating the ailment or symptom appropriately as well. I don't know if anybody was on the call where Jesse went through and talked about logs of giving medication. That would be another audit that would be very helpful for your facility. So that's another area to audit. But when we look at specifically the facility medication administration, this is where your antibiotic stewardship program would become relevant. So monitoring the antibiotic use, it can help identify if the antibiotic is appropriate to treat the ailment, and then also if there is any trending going on with ailments and antibiotics within your facility. And this would be a lot with your pharmacy and your medical director. So that's another area to go ahead and analyze. And then also, we want to make sure that every department is involved in your auditing process. So we like to look at environmental services. So they have opportunities for a lot of various aspects of auditing. Specifically, the ones that we've identified recently would be the concentration levels of your cleaning products, making sure that those are mixed according to guidance, making sure that they are mixed appropriately to kill everything that needs to be sanitized or cleaned appropriately. So those things need to be audited. We can look at utilizing the products as well according to manufacturers' recommendations. So are we leaving the toilet bowl cleaner in the toilets long enough? Are we looking to excuse me, are we looking to clean appropriately with the right cleaner in different areas? Because sometimes, you look at your Sandy wipes as opposed to just your other solutions that you may have. So we want to make sure that those are being appropriately used. And then again, as we kind of reflect back on infection prevention, which is kind of our high level here, we want to make sure the IPs can audit the environmental services cleanings as well. So utilizing aspects such as glow germ, that's where you put a spray in a certain area, and then you can go back over with your black light and see if it's been appropriately cleaned or if your product is actually working to clean the area. So that could be another audit that the IP can use to help out environmental services. Next slide, please. So here's where we want to capture these audits and get credit for your work. So first and foremost, we want to make sure that we're spreading the love with these audits. All staff can conduct audits. We want to make sure that we obviously train and give them the right tools appropriate to conduct these audits, but then also to ensure that 20% of your audits are being done on those off hours, meaning nights, weekends, outside of your normal 8 to 5 hours or 6 to 2, where your core staff is in the building. So with that, you look at paper forms. And again, Mountain Pacific has a lot of options for you guys, as well as the CDC. So if you guys are looking for paper forms, please do not hesitate to reach out. Don't reinvent the wheel. We have a lot. If we can't find it, we will reach out to other entities and see what we can find for you. Also, a new thing that's coming along to be mindful of there are a lot of apps out there for smartphones and tablets. This is to eliminate that paper form and to help you capture your documentation and conduct more like graphs and all those kind of fun stuff that you guys would have to otherwise manually enter. So again, there's multiple platforms available. It just depends on your guys's budget, what you're using. If your electronic health record is able to do that for you. But a few examples that I've noticed lately that are pretty popular are the iScrub Lite app and the ATP programming monitoring. So again, if you guys need access to those or any further information, please do not hesitate to reach out. But again, the iScrub Lite seems to be the front runner for these apps. So just trying to make your guys' lives a little easier here. Next slide, please. So here's a few resources when you look at audits. Again, I wanted to keep it at a high level. Obviously, I could probably talk for an hour on audits, what we need to do, what we need to look for, what audits to conduct. But just keep in mind that audits are supposed to work for you in your quality improvement process. So just make sure that what you are doing, one, is helping your facility, but also two, is utilized in an appropriate manner and can be offered for improvements within your facility. So again, if you need any resources or anything, have any other questions, please do not hesitate to reach out. We are here to help. And then with that, I guess I will turn it over to Carol Lopez, who is with the Disease Outbreak and Control Division in Hawaii. Carol, your turn.
Good morning, everybody. Thank you again for participating in today's It's Worth a Shot. Thank you two, for your wonderful presentations. That was very informative. I want to start off with thanking those for helping me to put this together. And Kelly O'Leary, my cohort on the Big Island, was a big part of this, and Crystal Morris with Mountain Pacific. So I want to acknowledge those two first as to how we got HIPAA off the ground. You can go to the next slide. Okay, so that is our workforce. We're presently having work group meetings every week prior to the meetings to kind of set up our agenda and look at what's going to be discussed next. So we have added to our workforce Katie Spalding from Kauai, Sherry McEwen from Maui, and Jaden Asensio from Oahu. And we now have Jolene Kajiyama, who is also with Mountain Pacific, and Lori and Mary, along with Crystal. So thank you all for making this a successful meeting. Next slide. So our history on HIPN, or our challenge, the long-term care facilities, infection preventionists never had a support group for networking. And there were several new and experienced preventionists in the role, and there still are in long-term care facilities. So after completing an infection control assessment, one of the ICARs at a long-term care facility, I had an IP ask me back in 22, was there any support groups out there for the long-term care IPs? Is there any way that the Department of Health could assist with perhaps getting a network group going? So I thought, wow, that's a really great question. And that's when I went to Kelly, my cohort on the Big Island, and said, how about this? Do you think we could set up monthly meetings with our IPs and find out what they want to learn and kind of create an educational session, a networking session? Kelly spoke to Crystal because we're working with Mountain Pacific with Project First Line. And Crystal let her know that Wyoming already had such a group in place. So over time, she was willing to assist us with the HIPN group mail, setting up a variety of different things and working with us. So Mountain Pacific is our partner, and it also helps all of you to understand their role and what a wonderful resource they are to us. Next slide. So the CDC's Project First Line in collaboration with Mountain Pacific was implemented in 2022, and I shared the lack of support with this group, as I had just mentioned. And then we decided, let's have a standing meeting monthly to look at how we could create these meetings. And then everybody agreed that we would have the HIPAA meeting the third Tuesday of each month. And at that time, it was 11 to 12. I think we have since changed it to 10:30 to 11:30. The meetings featured case studies, micro-learning, professional development, Project First Line infection control, and partner spotlights. And a listserv for the long-term care IPs was created, and a Google email group was created. So that's your HIPN group that you folks usually email each other on or ask questions on, or you get emails from a variety of people. The registration flyer for HIPN series was created. And then the goal of the IP listserv was to support the long-term care IPs, especially the new ones and inexperienced ones. So with that, we'll go to the next slide. The third Tuesday of each month began October 11th, 2022. So it's been what, 6 months that we've had active meetings. Monthly agendas were created and sent out. We've had polling questions, question and answer session, team members rotate facilitating, and then the creation of HIPN group has provided immediate support for the long-term care IPs, and I think developed an improved trusting relationship amongst HDOH and Mountain Pacific. Next slide. We have around 140 members total, and that includes a lot of IPs, alternate IPs, other members that are helping support the group. On an average, we've been seeing a monthly attendance of around 31, which is a really good turnout for a new group meeting. And they do ask for evaluations at the end, and the average satisfaction rate has been 4.82 out of 5. Conversations and posts have been created, around 196. So a lot of activity has occurred in 6 months, which shows me there was a great need for this group. So I'm hoping you all feel a value to this and that you are getting something out of it and it's what you wanted. And we're here to help you and provide you with what you might want or need. So reach out and ask us at any time to see if there's something we're not touching on or that you'd like to have discussed. Next slide. So I wanted to get some member feedback on the HIPAA group. And I've received emails from a few IPs. And one of them, quote unquote, said, I appreciate the opportunity to interact with subject matter experts from DOH and elsewhere, and to hear what other IPs in Hawaii are doing about all the stuff coming at us, emerging pathogens, rules, regs. And then another one emailed to receive clarification on a topic that was discussed at one of the HIPAA meetings. And then after that discussion that we had, she scheduled an ICAR for that facility. I mean, we are scheduling ICARs now and have been, but she hadn't given me a date. So at that point in time, she went ahead and scheduled an ICAR. So I thought that was a success as well. The new inexperienced IPs stated, I have a lot to learn. I appreciate the resources and information shared in the meeting. So for me, I'm very excited and happy to see this kind of outpouring success from short term that we've been having these meetings. And I believe it's showing everybody that it was well needed. So thank you to Mount Pacific for their help. Thank you to our team for putting this together. And thank you all IPs that are on the call for just taking the time out on these Wednesdays to either join the HIPAA meetings on Tuesdays or join the It's Worth a Shot. So thank you. So if you have any questions, that's all I have to present.
Thank you, Carol.
You're
Any
welcome.
questions? No, we sure find value in these weekly opportunities to connect and ask questions of each other, share best practices. And we've been hosting this weekly webinar now for over a year. So it's just a wonderful platform where we can all join, and we sure value our guest speakers. So thank you, Carol, and thank you, Shay.
Well, thank you, Jesse, for allowing us to share our success from the Hawaii point of view, from the DOH side. So that we appreciate that, because we know we have a broader population on the It's Worth a Shot. So thank you.
Right. Absolutely. I see there's just a quick question in the chat. If Jessica would like to get an invite to the monthly IP meeting. Jess, if you could put your email in the chat, we can get Crystal or Carol, and we'll get you connected, get you invited to that IP meeting. You bet. Today marks number 70 for It's Worth a Shot. Thanks, Miranda. And it looks like Scott Kinsey would also like, nice last name, Scott. Scott Kinsey would also like an invite to that weekly IP meeting. Scott, same, if you want to drop your email in the chat, I can connect you and we'll get you on that thread. All right. Well, thank you guys. We sure appreciate it. Again, thank you, Carol. Thank you, Shay. We do have the evaluation link in the chat box. And as always, if you have a few moments to complete that, we sure appreciate it. And we appreciate our partners. And I think that this is just a reflection, Carol, of how we can collaborate and help align resources and support each other. So we appreciate it. It's a win for everybody, and we thank you all for listening in this week.
Thank you.
All right. Thank you, guys. Take care. Be well. Same time, same place next week.
Thank you.
Thanks, Carol.